channel, where you can also find all the previous ACAP presentations. So today's presentation is called Morning Stretch Movement for Older Bodies. So this morning we have Dr. Karen Bergbacher, got it right, with us, and she's going to be our presenter. She graduated with a master's degree in physical therapy from the University of Kentucky in 1997. And for the past 15 years, she's practiced in multiple settings, including acute care, inpatient rehab, and home health with an emphasis on outpatient. In these settings, Dr. Bergbacher has cared for patients with primarily orthopedic and neurologic involvement and is now a board-certified clinical specialist in geriatric and neurological physical therapy. She has specialized further in vestibular and balance rehab. She began her service to Brenau as a clinical instructor in the early immersion of the program at Northeast Georgia Health System since the department's opening in 2015. She earned her doctorate in physical therapy from Shenandoah University in 2019 to prepare her to advance to full-time faculty. She has a strong passion for assisting and empowering patients in the rehabilitation process and feels very fortunate to be able to pass this on to her students. So welcome, Dr. Bergbacher.
All right, good morning. I'm happy to be here to speak to all of you, and it's been great to come out into the audience and meet you and to see what brings you here this morning so I can tailor this presentation for your interest and needs. And so, I've been a physical therapist. The math on our website is a little bit wrong. Actually, 28 years I've been practicing and then teaching for the past 10. And I teach the geriatric content and some of the neurologic intervention and prosthetics and orthotics, and love that role. So please feel free to speak to me during this presentation. There are times I will ask you questions just to keep it interesting and fun and interactive. So feel free to let me know. My plan in looking at the objectives was to initially just talk about what optimal aging looks like and to hear that from participants, but of course I'll fill in what I teach in courses from what I've gathered in talking with others and in looking into this topic, and then talk about what are normal general changes that occur in the body with aging typically, and then also go into some of the common chronic diseases that really are often linked more to can be linked more to sedentary behavior, lifestyle concerns, and then really talk about how we can combat that with exercise, giving some guidelines. And then my plan was to go into different tips of how to overcome barriers to exercise and also assist someone at the appropriate level of need. So we can kind of determine how we'll talk through that. I wanted to make sure to give the audience what was needed today. So, all right, let me get used to this little clicker. Okay, so I was going to ask, ideal aging. Can you all tell me what that would look like to you? As you picture yourself kind of aging over time, can you think of things that would be important to you for quality of life?
Staying active.
Staying active, absolutely. So that's a goal of many, because along with staying active, that can keep you in the living environment where you would like to be, right? So it's important to be active so we can maintain strength and then be able to live where and how we would like to. I can help with more if I have some pictures of so I try to expose to students that aging looks very different across different folks and populations, but a lot of what people want to hold on to are ability to move, ability to interact, ability to keep attending things that they like to do as far as work or interaction with family, able to get out and play with grandchildren, able to continue to do things with children, keep social connections, be able to go to church. All of these sorts of things are very important for our older adults. So just examples of different exercises. Hopefully that would encourage that, but not all of these are tailored toward exercise, but interaction with family as well, and just to be able to continue on with things that bring them joy and meaning, right? Okay, so I stole those pictures. I didn't steal them. I borrowed them from the U.S. Department of Health. There's a really nice handout here called the mid-course report. And it goes over a lot of information that I'm going to include in this PowerPoint, so I've cited it through so you can tell what the source is, so you could go to it and utilize it. Okay, so just talking in general, thinking about the different systems of the body. I'm not going to get too into depth and too academic here on you, but just wanted to talk in general what happens. So we've got 4 main systems. I'm going to talk about the musculoskeletal, the nervous, cardiovascular, and respiratory. So with the musculoskeletal system, referring to muscles, bones, and joints, a big one that I really want to highlight first is what happens with muscle loss. So this happens younger than many people would think. What I've cited here from a source is at ages 30 and 40, but some will say that peak strength is in the 20s. Of course, that's all relevant to what somebody does with activity, so that's going to change. But in general, this is the typical. But that muscle loss and decline really accelerates at ages 65 to 80 unless you have purposeful activity to counter that, which is what we're going to talk about more so today. And then bone, we lose bone density over time as well, and that loss increases around the age 50, related to hormones, lifestyle, smoking, diet, those sorts of things as well. So osteoporosis, we know, is a condition associated with that, which puts us at a risk for fractures, which then can cause a big change in ability to be active and move, depending on the scenario. But hip fractures are a common problem with the older adults, and things that can cause them to eventually need to live at in a group setting or a nursing home setting. And then joints, what can happen there is we get thinning of cartilage. That's the surfaces that line the bones. Also, they can stiffen, and that's due to tendency for ligaments and tendons and muscles to lose elasticity. And then the nervous system, talking about how the nerves function, there can be slowing over time, and then how the nerves connect in the body, thinking about anatomy. We have the synapses, the chemicals that are needed for nerves, information along the nerves through the body to transmit for muscle contraction or receiving sensory input, that declines over time as well. And then cognition, we tend to all over time mild memory loss. So not speaking so much to dementia or more advanced things such as Alzheimer's, but more just a mild decline because of the things mentioned, like the slowing of the nerve processes, maybe a little less mild decrease in circulation to the brain. Those sorts of things cause these things. Cardiovascular system, we have stiffening of the blood vessels. So that can cause greater work on the heart because you're having to push, it's having to push blood against the resistance of those vessels. And then that works to increase blood pressure. And then with the heart, that is a muscle. So over time, the changes to the muscle that we heard about earlier, loss of muscle fibers, loss of ability to contract as strongly will occur also. And then as you age, there is a decreased ability for the heart to adapt to the demands of exercise. So as that goes up to be too intense, the heart will stop its ability to go up to increase heart rate. And then respiratory, we have changes within the lungs. So we know that the lungs expand and contract, and so that capacity decreases with aging. And because of that, less surface area, there's less efficient gas exchange. And then containing the lungs, the rib cage loses ability to, since it's controlled by muscle, to expand and contract, loses that capacity as well. So those things together, the decrease in the lung capacity and decrease in the ability of the ribs to expand and contract, we've got less overall gas exchange. Okay, so those were the 4 main systems. We talked about musculoskeletal, nervous, cardiovascular, and respiratory. Okay, so a little less academic now, except for one topic. Has anyone heard of sarcopenia? So really tied to strength. Loss of strength is really a concern for our aging adults because it's so tied to function. So when we break apart activity and we think of what's required to remain active, we've got to have flexibility, strength, coordination, all of these sorts of things. But muscle strength is one that, as I mentioned earlier, that we have a loss from age 30 to 40, but it really starts to ramp up and escalate if we don't counteract it at age 65 to 80. So this is when there's a significant concern for loss in function if we don't address it. Okay. So the definition of it is gradual loss of muscle mass, strength, and function. It does change a person's ability to do daily tasks. So there's kind of hints in this picture, but can we think of function throughout the day that would require the most strength? If you're just thinking about someone's mobility, walking to stay upright, absolutely.
Getting up from a chair.
Yes, you just read my mind. Just hoping getting up from a chair requires a whole lot of strength in the quadricep muscles, the gluteal muscles. So we've got to have the power to be able to do that, to get up. And that's when a person loses that ability, that often leads to a change in where they're able to live, be able to get up. And a lot of people will go to single level homes because of difficulties and build ramps, difficulties with stair negotiation. So I really emphasize this talk on this concern because to try to empower all of you to talk to others about how to combat this through strengthening exercise. Okay? Let's see if there's anything else. So what the symptoms are when somebody comes in, because we have some medical providers in training here this morning, we have a loss of stamina overall, so just general fatigue. Difficulty performing the physical activities that we just described. So getting up from a chair, slowing with walking, that's actually in there as well. Difficulty with getting up and down stairs. They'll mention these sorts of things in your history, and this should trigger us like, ooh, we should think about sarcopenia specifically. As physical therapists, we're always assessing strength. We use resistance testing of different areas of the body to determine why somebody's mobility has changed. But in general, this is kind of an overall picture of whole body. Okay? And so some causes, aging itself contributes to this. Also, physical inactivity will escalate it if we're not active. That's going to compound that. Obesity kind of starts a cycle of maybe making it more difficult to exercise, and then with not being able to exercise, you're going to naturally gain weight. So there's a cycle that can happen there. Chronic diseases will contribute to somebody's ability to feel well and be able to exercise effectively. The cycle of the loss of mobility, if someone becomes less mobile, then it's hard for them to get up and move around to exercise. That's where we come in as healthcare providers, especially in my role as a physical therapist, others that work on strengthening to try to meet somebody where they are and be able to work on the muscles at a targeted level that's appropriate for them. Other things that can contribute are insulin resistance, so like what we see with diabetes, and then a reduction in hormone levels in general that occurs with aging. Okay, so how do we diagnose it? This may just be an interesting tidbit for those. This is what we would do in physical therapy, but also some of these tests other healthcare providers could administer. But we've got a hand grip test, so we have a special dynamometer that we use and have somebody grip as hard as they can, and we'll record that. And there are established norms for ages, and then what would indicate a loss of typical strength for that person's gender and age. And then we have the chair stand test, so how many times can they stand up within a certain period of time without using their arms ideally. And then walking speed, so how fast somebody can walk, can indicate lots of things about their health. So we have lots of established norms and scales that we look at because that can indicate and kind of explain where that person is in their well-being. Timed up and go is simply for the person to get up from a chair, walk 10 feet, turn around, come back and sit down, and we have norms for that as well. And then imaging can be done, certain scans to look at muscle mass. So in general, that's how it's diagnosed, but easily we can address the first 1, 2, 3, 4 in physical therapy. Just thought it'd be good, though, for those that are considering this for a loved one or a person they're caring for, that this is how it's diagnosed. Okay, so we've talked about, in general, what occurs normally with aging without tying it too much to conditions or chronic conditions. But as these things kind of move into normal aging, into pathology, here are from the NCOA, we've got 10 of the common chronic conditions. So when you look at these, you could imagine some of the things we looked at earlier with normal aging. When those changes escalate, it leads into these types of diagnoses. And then take a look at how much we can treat with activity and exercise as medicine to address them. So we've got high blood pressure, high cholesterol, arthritis, obesity, diabetes, cancer, heart disease, depression, COPD, and asthma, all which can be impacted by the appropriate prescription of exercise.
So does that show, like, with the appropriate amount of exercise, someone with hypertension, they could improve 61%?
No, so this is more just the chronic conditions and typically what is seen. So not improvements, but just the more of how often you would see this condition, or what percentage of the population would have it. Yes, you're welcome. Good question. So the point of that slide was more to show when we looked at the general declines that occur naturally in aging when they escalate, which a lot of times can be escalated by lifestyle. It'll lead into these sorts of conditions. And then when looking at them, we know that there's research out there to show that exercise can decrease the severity for sure, and or prevent or turn around most of these. Okay. All right, so what are the health benefits? So looking back, it's kind of amazing to realize, this is from the CDC, that even a single bout of exercise can make significant change in someone's health. So the immediate benefits, so looking at what the immediate benefits are improved sleep, which we know that sleep is significant for lots of things. So stress, heart condition, fatigue, just general activity in life. So quality of sleep is very important. Anxiety, so if we can manage stress, so we know that stress has a huge impact on our health, like heart conditions. Overall, it can lead into depression, can lead into being less interactive with others, and decline in quality of life. So that's a huge effect if we can decrease anxiety short term. And then with ongoing exercise, it becomes a long-term benefit. Blood pressure as well. So if we start to work the heart, we get it pumping and relaxing, we get that muscle working more efficiently, that can certainly have an impact on blood pressure. Okay? And then long-term, significant benefits. So this is now regular physical activity built into a weekly schedule. Not an everyday, I think we'll talk about this later, but when it becomes a regimen that has to be so harsh, then people sometimes have a hard time meeting that. But in general, you want to have the activity on a regular basis so that you can benefit this in these ways. So brain health. So we know that pumping the blood through the body and getting better circulation to the brain, better nutrients, that's going to supply that brain, and we're going to have overall health and better function and maybe prevention of Alzheimer's. Heart health, just how I mentioned earlier, by getting the heart muscle to pump and relax, you're going to have better circulation of the blood through the body, and you can over time decrease the risk of heart disease, stroke, which is a lack of blood supply to the brain because it's kind of a connection of a problem between circulation and brain, so we can prevent that, and also diabetes. There's lots of specific cancers, some more than others, that can be prevented with exercise. So we've got a nice list here, but lowering the risk of bladder, breast, colon, endometrium, esophageal, kidney, lung, and stomach cancer. So in addition to helping to prevent, when someone has that condition, you can also have a much improved quality of life as we go through treatments and recovery. Healthy weight, so we can understand the relationship of exercise and weight, the importance of burning calories. Independent living, we've talked about this already, that we've really got to keep strength up so that people can get around and move in their environment as much on their own as possible to keep them living independently in the setting they would choose. Bone strength, so when we put, in particular strengthening, we have the muscles pull on the bone while we do strengthening exercises. It's going to make the bone more dense, and so that can help with osteoporosis, prevention of it, and treatment of it. And then balance and coordination. The more that we challenge that, that's a love of mine. So the more that we work on getting somebody upright, you can do, work on sitting balance and standing balance, but relying on less support and relying more on your body's own coordination and ability to react and your muscles to contract and keep you upright, that's a benefit as well. And so balance has to be challenged beyond somebody's capability, just like strengthening. To benefit from strengthening exercise, you have to keep pushing the envelope of what you can do to get good gains. Okay, so these I won't go through too long. So this was a slide about prevention primarily, but I did mention a few things about how we can decrease severity of conditions. This one is about, so being a physical therapist, I'm working with people with problems, so health conditions such as these, and can see firsthand the significant amount of benefit that people receive through activity. So it's good to think about prevention, but then also the different ways that you can help people that do present with pathology. So cancer survivors, big one of improved the quality of life overall, and then lowering the severity. Osteoarthritis, so a lot of times people will have joint pain and then feel like they've got to limit motion, when actually the truth is you've got to move in the correct ways and have more movements to help the health of the joint and to help increase the strength of the muscles around the joint, and that can help to decrease pain. Now there are times where it gets so significant, surgical intervention is needed, of course, joint replacements, all of those sorts of things, but you can do a lot to decrease the severity through exercise. Hypertension, so we talked a good bit about that one overall with being able to improve the muscle contraction of the heart. We can lower disease mortality, so the severity and likelihood of someone dying from cardiovascular disease by going in and improving that function. People with type 2 diabetes, we can improve the sensitivity to insulin. So insulin resistance is a common problem that causes more severity of diabetes, but we can make those cells more reactive to exercise and with exercise, more reactive to insulin. People with dementia, as we improve brain health and also stimulate someone into activity, can help to decrease the symptoms of that as well and improve cognition. And then these are other neurological conditions we have listed now that are not necessarily the general, but people with MS, spinal cord injury, Parkinson's, stroke, we treat all of that, doing a real specific assessment for their abilities and then go in and meet those needs. I'll move on over those for this presentation. Okay, so what are some exercise guidelines? So we've talked about the benefits through prevention of disease and then also helping to lower the severity and sequelae of disease conditions, but what's needed? So this is a listing of physical activity guidelines for the older adults specifically, okay? So they're just a bit tweaked down from the adult. So it's good to encourage those to participate. I find it's hard if you put high demands on and immediately go to the top expectation. It's often hard to meet that, and it's hard to get started. So that can become a barrier. So just looking at, okay, how could we really make this work for somebody is good to consider. So 150 minutes a week. So sometimes you see things higher like that, like 300 minutes in like younger adults and that population. But if we can get someone exercising at a moderate intensity, so now we're talking about aerobic activity, one of the components of exercises. You have aerobic, strengthening, stretching, balance, all those categories are important to address. But specifically aerobic activity, which is just repetitive activity like walking, jogging. There's some examples coming up in a little bit. But it's ideal to get at least 150 minutes of that per week. So divide it up however needed. That could be 30 minutes a day, 5 days a week, or that could be broken down where someone does longer amounts, fewer days a week. But what we're finding is even like, they call it exercise snacks are okay. It's okay to do like 5 to 10 minutes at a time and have that be accumulative. And some of the patients with higher severity conditions really have to do it that way. And then they have to realize that that's okay. You don't have to do a 30-minute session to benefit. These shorter sessions that can build up throughout a day are important. So we'll do the TV commercial exercise, things like that, to get someone to think about, how can I fit this in my day? I don't have time, or I'm just not motivated, or I need something to remind me to do this. So just thinking about exercising during TV commercials, or exercising, setting up a timer, but trying to start somewhere, because eventually the body will crave the exercise if you can do it enough. Many of you probably know that. But that's where we want to get somebody. It's often hard to get started. Okay, so moderate, we'll talk a little bit more about what that looks like in a minute. And then strengthening. So I mentioned earlier there are several components or types of exercise that are overall good, but the two biggies, as you see right here highlighted, are the aerobic activity for heart health, and then all of the benefits that come along with it. And then strengthening, as we mentioned, the risk of sarcopenia with aging and the negative effects of that. So for strengthening, what we'd like to have is 2 days a week that we're working all the muscle groups, okay? So that doesn't have to be to the max. It just has to be to challenges the person. And many of us know we like sets of 10. We try to get away from that, and just really where someone can do anywhere from 5 to 12 reps of an exercise where they can control the movement, whether that's active range of motion. We've got people that can barely move, and just moving their limb is significant, to adding all kinds of varied resistance, which could be bands, dumbbells, machines, just depending on where they are. So that's why I wasn't sure what to come with today for that. So I didn't bring, we'll just talk about categories. But anyway, lifting something that is typically harder than what they would normally do, as long as it's in that category, it's beneficial, no matter how it's administered. And then another suggestion, you'll see something called multi-component activities. And that's at the bottom. And what that means is you can sometimes combine all of these things. Like you could do walking lunges, so sometimes it's, or you could do something like Tai Chi, or where that's like slow, controlled movements, but being upright. Walking lunges, I won't demo. We're familiar with what that might look like, but you could have the person hold on. They could be shallow. We're, as a PT and exercise professionals in general, good at modifying things to tailor it to what somebody can do. But you just have to think. But multi-component in general is a mix of aerobic, muscle challenge or strengthening, and then balance too. So like a walking lunge would be like a great example. But it doesn't have to be a deep, severely challenging. It can be modified to someone's capability. Let's see, even in the water is great. If someone can get into the water that has arthritis, that's a really great environment to exercise in, because the buoyancy unweights the body. And so there's pressure taken off the joints. That can be challenging to get there, but it can be a really good place to start. Any questions on any of this so far? Anybody? Yes?
So what are your thoughts on the weighted vests? Because I know right now, like, everyone's like, get a weighted vest, and work out with them, so they're like foam loss. Is that something you would recommend, or?
I think it's early in the administration of that, but it does make sense. In particular, if you need it in the chest area, or really any of the more weight that you put on, it's going to pull at the bones and then cause density to increase. So it does make sense to do it. You'll have to continue to watch the research of what the findings are. But also, in addition to the muscles contracting more so, because they're not going to go to the max with the vest on, but it is, so it does make sense that because the tendon has to pull on the bone, and in certain ways may do it harder with the vest. It also will help to work the heart, more of a challenge that way. So cardiovascularly can help the heart rate to go up too. So I think those benefits, yes, I don't see anything wrong with it. I don't see a negative. Good question. Do you have one yet? I know. It's everywhere. Yes, I've debated on getting mine, but yeah. We do use them in therapy to help increase the challenge, but to have someone work against resistance is of course helpful with strengthening in all the ways. Okay, so this was helpful that, you may want a picture of this one because it comes from the handout that I addressed earlier about the physical activity guidelines. There's a resource cited in this PowerPoint, and this comes from that as well. So adults should move more and sit less throughout the day. Well, we all know that, right? So increase in activity in general is great. Typically, so for a general guideline, that second point there, I know you can't read this, I apologize for that, but remember we looked at the slide for older adults, it was at least 150 minutes a day of cardiovascular. So here it says that, even up to 300 is helpful. And then of course we always look at intensity of exercise. So the more intense somebody can exercise, so when we're getting vigorously up there with higher heart rates, and we're going to talk a little bit more about guidelines for that in just a minute, but then the less minutes are required because you're working at an intense level, you get such a benefit from that. But not everyone can tolerate that. So then we just need more minutes of exercise. So you kind of see that there's a range here from 150 to 300. And that, again, that can be divided up in any way, even 10-minute increments is fine. Sometimes people need to sit and just march because that's what they can tolerate, or sit and do alternate kicks, depending on somebody that's lower level, and that is okay. Let's see. Of course, you can benefit from more. We talked about the muscle strengthening. It is important that when we get somebody, and we, as an exercise professional and healthcare professional, we'll always be assessing somebody's heart rate, blood pressure, vital signs to see how they respond. So there is a safety thing of making sure that it's appropriate for that the person is stable enough to do exercise. So that's always a consideration that we have to have. So here, let's get into this section about how intense is okay for me, because we throw the term moderate out there, but what does that mean? So we use this scale. It's a rating of perceived exertion, and so it's a way to kind of think to yourself, how hard am I working, and how do I know I can stay in a safe range? Because we certainly have people that we need to encourage to work harder, and also that we need to encourage to work less to keep themselves safe. So we have a scale that we can use. And this is kind of in place of heart rate, because we often will use heart rate, and I'll talk about that in the next slide because it's more technical. But this is kind of a less, it's research proven, but an easier way to follow. And especially if somebody's on medication that will alter their heart rate response, because some meds will purposely, to treat a condition, will not allow the heart rate to increase. And so if the heart rate is not increasing, we can't always use that. Heart rate and pulse as a way to measure how hard someone's working. So we've got to take it subjectively, what they tell us and what they think about. So we teach this scale and we say, okay, here's a scale from 6 to 20, and that's just because how research was done. There is a conversion of a 1 to 10, but this one I just wanted to throw it up there. 6 to 20, and so it goes from, I'm working very, very, very light, like how I feel when I'm in a bed relaxing, to I'm working kind of hard, so this feels like I'm doing some, to where I'm in the very hard. It's really difficult to get this work done, and that might seem simple, but it is helpful because we use it. Patients we want them to stay overall in the green, which is in the somewhat hard to hard, so that they can get the most benefit. Of course, someone with a health condition that we are wanting to keep stable, we're going to go on that lighter end, and then someone that is healthy, we're going to push them a little harder when we encourage their intensity. Okay, so it's nice because we can keep asking somebody, how is it now? How is it now? Throughout a session. So that's one way. So the 12 to 16 on this type of scale. I'm going to give you another trick in just a minute. But in general, like someone whose health is fairly good, what moderate would be like brisk walking, and it's similar to like 3 miles an hour, 2.5 miles an hour. Swimming, playing doubles with tennis or pickleball, yard work, ballroom dancing, exercise classes. You see that we need a variety in here to really make exercise appealing to the most. Okay, so some other ways, there are 2 on this slide. There's a formula, so being technical, with someone that doesn't utilize medications that would alter heart rate response, you could use this one, and I'm sorry it's so small, Tanaka formula, if you wanted to look it up, Tanaka. Tanaka. This one is important because it's specific to the older adult. Some formulas, like 220 minus your age, is not as accurate for our older adults. This one is more accurate. So it's you use that formula, you plug in their age. So it's So heart rate max is what we're trying to find, like how high should I take this person's heart rate? And then you take 208, just as a number everyone would use. But prior to that, I should do the math order with parentheses, right? So 0.7 times somebody's age would be the first step. And then you do 208 minus that. So here's an example down here. For someone who's 60 years old, the first step you would do is take 0.7 times 60 and get that number, which is 42. And then you would take 208 minus 42. So that person shouldn't work higher than a 166 when they measure their pulse. And then the healthier they are, the higher percentage of that is allowed. So typically it's in a range of 50 to 70% is moderate. So of that number we just calculated with the formula, 50 to 70% is considered moderate. So you want to go on the lower end with somebody who has health concerns, of course, to keep them safe, and on the higher end with someone who has less health condition. And then here's a simple one that can be is just the talk test. They found it's been around forever. So remember, I was trained and finished in 1997. It's still in there in all the literature. You see it utilized. So it's held true. And it's just the talk test, simple, easy to use. Moderate is meaning that you can talk, but you could not sing, like you wouldn't be able to do that. And then vigorous exercise is when you can only get a few words at a time because you're short of breath. So if we want to stay moderate, it's where you're talking, there's a little challenge, and you definitely couldn't switch to singing. Okay, that's just a practical way. So we had the Borg scale, which is somewhat, good to use, especially with somebody on those medications that controls heart rate. To being real technical by calculating a formula, and then here's my range, and then can I talk, and how much challenge do I have? Okay, so strengthening in general, just some guidelines. You want to include all of the major muscle groups. Someone who doesn't typically like to strengthen, we're not going to go in and isolate every muscle because that makes their workout much more than they're interested in, right? But we could stay into the exercises that do multi-muscle movements, like rows and push-ups against the wall, where you're working triceps, chest, back, or if it's a pull, then you're working bicep, scapular muscles. But those kinds of multiple muscle groups are very helpful. And squats are a biggie, like that sit to stand is such a big deal to get up from a chair. Well, somebody can hold to a countertop and just do really simple, mini squats, we call them, to work those muscles, and then going down lower as they're able. And then abdomen, that can be done in all kinds of ways. You can do, regular crunches, but there's things that can be done in bed. So I'll talk to you all to see if anyone needs exercise ideas, rather, because there's so many ways I could go with this. But the key is to just try to pick exercises that are not just isolating one thing, but really working multiple groups at a time, so that you really could do that 2 days a week, work all of them, okay? So moderate, so again, the person's having some challenge. We look for the face sign where there's a little bit of strain in where they're not just easily doing this, because that's not going to make much of a change, but where they have to concentrate about it to control the movement of that weight. That's where you want to be. And then a gradual increase in that load as the person can do, say 8 to 12 reps, and then 1 to 3 sets. So this is all sort of variable. If somebody's just starting with strengthening exercises, you want to go more towards the 8 reps in 1 set, see how they do with that. And then as they enjoy it, can tolerate it, they're showing that they're doing well, then you can move towards the 12, 3 sets of 12, something like that. That's all relative, though, as far as the exact number. And then what are some good types of strengthening? Talked about that a little bit, but some people are weak enough that just moving their limbs is enough. And sometimes they need help to move their limbs. And so therapy will, be assisting somebody to lift their arm because they don't have the strength in the deltoids to do that. So there's a range where you're actually, we call it active assistive range of motion. Actually just helping somebody move a limb can benefit them. Hopefully they can move on from there. And then once that occurs, then you're using weights like wrist weights or dumbbells or resistance bands. We like to give those out, and that's an easy thing to utilize. And then on into your things you would see in a fitness center. Okay, Body weight exercises, I kind of showed you an example of that, the little push up against the wall or a lunge or a plank. All of those are beneficial. They can be made simpler so that somebody can do them. Also, benefit from yoga. There's lots of modified yoga, chair yoga out there is really beneficial. And then Tai Chi is done in all different kinds of ways too, but a very big popular item for the older adults. There's a lot of research coming out that it's very beneficial. And that's something they can easily enjoy and do in a group, which is important. And then just general daily tasks can help to keep somebody. So keeping somebody engaged in things at the home, doing dishes, folding towels, any of those sorts of things, all the way up to doing gardening, which is more intensive, is important to keep someone active. Okay, just a nice little infographic from the American College of Sports Medicine on resistance training. And so we've already talked through most of these, but the benefits, brain health, muscle health, bone health, helping with growth hormones, helping with regulating glucose. What else? We've really talked about most of them. All of the conditions that can be managed. You see that's a huge long list. We've really talked about most of it already, but just to plug where there's research that they utilize to help develop this. So some that we hadn't talked about, let's see, fall risk. So we look at that a lot in therapy. But the more we can keep somebody active and challenging their balance safely, there's lots of, you have to consider, if to challenge balance, you have to make it hard on the person where they struggle a little bit. So we have to be creative about how we keep that safe. We don't want them having a fall. So we do it a lot in the corner with a chair in front of the person and then give them balance exercises so they have that safety net around them, but they're challenging themselves. Frailty is when someone, just overall with age, starts to decline in lots of ways. In lots of body systems, they can start to become what we call frail. It's not just weak, it's also they easily get ill, those sorts of things. It can help pull somebody out of that. Insomnia, so strength training can help with sleep. And most of all the others we've already talked about. Okay, move on. All right, this is actually, we're getting close to being done. So oops, I'm sorry, let me go back. So body movement for various stages. Here's where I was going to maybe have participants let me know if they're needing ideas for someone. So aerobic exercise, as I kind of talked earlier, that could be as simple as doing repetitive movements and sitting. You might have somebody, sometimes even in a hospital setting, we work with patients and we'll have them do repetitive arm lifts, sitting up as tall as they can, kicks, marches, all the way to those that can, tolerate more. We can go into walking, treadmill. There's New Step. If anyone does exercise with older adults, there's a really nice piece of equipment that can help, but it would be more, they're on the pricey side, so probably more fitness, but some people could have them in their home. But it's sort of a piece of equipment that you sit down in. It's not really a bicycle. It's more of you're pushing against resistance, but it's not in a circular motion for both arms and legs. So the arms are doing kind of this motion and the legs are also doing the same. And then you can add resistance to it. And that's a very joint-friendly way for aerobic exercise for lots of our older adults, in addition to kind of like a recumbent bike. Aerobics, water aerobics is a really good way to get this if someone's struggling to tolerate being upright and moving well. Strengthening exercises, kind of talked you through that progression already ahead of the slide. So assisting somebody with movement to doing movement on their own where they can move their limbs to adding resistance is how we look. And then balance exercises, we talked about that already too. So being upright, sitting, standing without support. We had challenges like we start with static balance, so just being able to stay still in a position, sitting or standing, to then maybe adding some dynamic movements and some reaches, things like that. Then we'll put patients on surfaces that are unstable, like we have these foam pads. They're called AirX pads in PT clinics. If you've been in one of the blue pad that everyone sees, it's really dense foam where it takes away sensory input from your whatever if you're standing on it through your feet, but it also varies the surface, so it makes it a little unstable. So we put people on unstable surfaces, we have them close their eyes, we make them move, make them do all these, we throw things at them, all kinds of things to try to work on balance and balance reactions. And so as long as that can be done safely, we get very good results from it. So, but again, working from simply to more complex. And then that multimodal exercise that was mentioned earlier, it really combines all three into sorts of movements where we can create, I'm talking about therapy-wise, but like that walking lunge that we talked about, or like the Tai Chi, where you're challenging muscles by putting your body in positions that make the muscles work harder than just being upright, but it's also a balance and movement activity as well. All right, barriers. Okay, kind of alluded to some barriers of exercise already. So sometimes it's just the getting started, not knowing enough about where you can start. So we will, and being a physical therapist, we'll deal with patients primarily having mobility difficulties or having illness. So that's a big use to that, being able to come in and meet somebody where they are and make it doable so that they can eventually expand and do more. But I know time can be one, so kind of throwing in how you can work that in little bits throughout the day. Money, but you can be real practical. The resistance things that you use can be cans in the home, can be we do the soup can exercises, gallons of milk, all those kinds of things can be utilized for that. Being able to get somewhere, that's a big one. That can be a challenge for somebody. But there are so many YouTube resources out there now as well. So lots of online seated exercises, standing exercises, all different types of challenge, that there's so much out there just for, really done very nicely that people could follow. So there are ways to overcome those. Can anyone else think of another barrier or something you've come across that you've tried to encourage a loved one or older adult that's been hard to overcome? Oh, stubbornness. Well, a lack of desire to do it, and then being real strong. Yeah, that absolutely is one. So the more fun we can make it, and the less trying to not build too many requirements, but just starting somewhere where they may not even realize. Try to tie it into a hobby or something and gradually increase the intensity over time is really the best way. We certainly come across that in therapy too. And you're right, it is a challenge that's not uncommon.
And showering, taking a shower, that's not really an exercise, but that's definitely.
Absolutely. Like you meaning that
take a shower and just put it off.
Okay, even trying to avoid needed
Yes.
daily activities.
Yes.
Yeah.
What
That
are
can
some
be
tips?
difficult. Some tips on getting someone. How do you make showering fun? Ooh, gosh, I don't know. Anybody ideas on that? You can play favorite music. I'm just kind of thinking back to how we do that with kiddos, but yeah, find out the likes of different soaps or different sponges or things that they enjoy might be a way to do that. Are they sitting versus standing? Okay, trying to make it tolerable that way. Sure. Yeah. All right. Well, then the last little bit. Anyone else have a barrier that you want to discuss? Is really the resources, and they're tremendous in this area. I didn't list things out specifically, but Legacy Link hosting this here. When you look on their website, because that's where I started because I share with my students all of the resources because I want to make sure that they're aware that they should search for those things to help with their clients in the future. So I do point them to these websites to where that they can see what all is out there. I mean, from online exercise to all the group exercise that's offered to social things. We're really trying to, it's good to see the efforts out there to make quality of life so much better as we're going through really for every population. I think we're doing a better job of that in general, but for our older adults in this area in particular, tremendous amount of support out there. So if you go to Legacy Link, then you'll see 13 surrounding counties and then all of the senior centers affiliated with those, and then you go and look into their exercise classes. It's all right there for you. You see what's offered, and it really is huge. So just know that at varying amounts of degrees of intensity, there really are lots of offerings that are very impressive. So, any questions for me? How did I do on time? We went over a little bit. Any questions from anybody? All right, well, thank you so much for your attention. I'll be available if you want to come up to me individually. You're welcome.
All right, thank you guys so much for attending. We are not going to have a December ACAP program, so we'll start back up in January, and we're going to be releasing the sessions for the entire year, hopefully start of December. So you guys can look on the website, you can look on the Legacy Link website to find out what's coming next year. Thank you.